A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with our supporting partner, Yashoda Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passion of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with the introduction. I welcome Dr. Prajit Majumdar, Senior Consultant, Nephrology and Renal Transplant, Yashoda Multi Specialty Hospital. Welcome, Dr. Majumdar.
Hello. Thank you. Thanks for the nice introduction.
Wishing you a very happy Doctor's Day.
Thank you. Thank you, Dr. Ritika.
So, starting with this series, so apart from medicine, what other hobbies or interests do you have?
So, as we know that in this fast track world, that where this stress and everything is very much increasing, I think that everyone should have hobbies and everyone should be enjoying their hobbies. This is particularly important so as to reduce the stress. And stress, as we all know, is directly proportionate to the cardiovascular risk. So, my general hobbies are like every normal person hanging out or exploring new places, playing outdoor games, especially when you're in India, everyone loves cricket. So even I love cricket, and obviously I love like playing indoor games like chess and all. And apart from that, I love going out to movies or going out to eat food or so these are my main hobbies.
Sure. Yeah. So I think cricket is one of the favorite sports that is in India is one of the favorite sports, and traveling is one thing that you enjoy. So it's very good to know your personal front as well, apart from your professional life.
Sure.
Keeping on to the professional front, Dr. Majumdar, what are the emerging technologies or approaches in the field of nephrology that hold promise for the future of renal transplant procedures?
So, as we all know, in nephrology, apart from managing patients of chronic kidney disease, managing patients who are on hemodialysis, and creating and managing the complications of vascular access, renal transplant is one of the most important things for a nephrologist. So, the renal transplant, there are a lot of new things in the field of renal transplant that I would like to talk about. So, there's certain new approaches. For example, first, I would like to talk about the paired kidney donation. So that is on the rise. So what is that? Most of us may be aware, but for the general population, they may not be aware of it. So people who go for the normally the donor and recipient pair who go for transplant, if due to some medical reasons or due to some ABO incompatible reasons, they are not medically fit to each other. So what we can do is they suppose there are two pairs who are not medically fit to each other, they can exchange. So this is called a two-way swap. Similarly, there is a domino or a three-way swap. That is when there are three pairs who are not fit medically between themselves can swap between themselves. So this swap transplant or this domino transplant is on the rise, and I think in the future this will help a lot of patients who are not medically fit, thus increasing the number of transplant and thus saving a lot of lives. Apart from this paired transplant, I would also like to talk about the ABO incompatible transplant. Well, so ABO incompatible transplant has been on the rise for the last 10 years. But the most important thing that nowadays that we are using is the use of the glycosol columns. So by the use of these columns, what happens is we can do transplant of patients who have ABO incompatible titers in high titers. So this column technology helps us to reduce the number of titers, and thus people having high titers can undergo transplant. Apart from that, I would like to also talk about biomarkers. Biomarkers for in transplant. So what are biomarkers? So we all know, suppose a patient was undergone transplant, is undergoing rejection, or is after transplant, when the creatinine has come down to normal, the creatinine gets increases, and we suspect, the doctor suspects that the patient may have a chance of rejection. So generally in such cases, after initial investigations, a renal biopsy is done. However, in the initial period especially, renal biopsy is associated with complications like bleeding, and in some rare cases even graft loss can occur. And so we know renal biopsy is an invasive thing. So to diagnose this rejection, apart from renal biopsy, now certain new markers have come. So there are like these markers like cell-free DNA, or these markers like granenzyme, or markers like this non-coding RNA. So what are these? These are simple markers which can be done via blood test. Thus, the patient can avoid renal biopsy or this invasive procedures, and thus they can help us in treating the patient. They can help us in diagnosing rejection. So these biomarkers, I think, in the coming up few years, will be something that every hospital will be doing, and that will obviously help our patients. Apart from that, if you look at the certain new drugs, a lot of new drugs have come out. So suppose a patient who undergoes transplant, after a few years, if he or she may be diagnosed with chronic rejection, in the previous eras or in the previous years, if a patient was having chronic rejection, uh, there were not too many medicines which could have helped the patient. But now there are a lot of new medicines which have come up. Especially I would like to talk about tocilizumab. So this is a medicine that is frequently being used these days to treat chronic rejection or chronic antibody rejection, or chronic active antibody rejection. So these new medicines are there nowadays which can help us to treat rejection, especially the chronic form of rejection, which previously did not have a treatment, or had treatment with very not so good results. Apart from that, there are certain drugs which are now being used, like this imlifidase and all these drugs. They can be used to treat patients who are highly sensitized. uh, Talking about other new therapies, I would like to talk about the robotic surgery. Although this is a domain of mainly the urologists, however, robotic surgery is on the rise, and this is something which is associated with very less pain, very fast post-operative recovery, very less bleeding, and this is especially important for patients who are obese. So, patient who are obese, or patient, or this is cosmetically better associated with less bleeding. So this is also on the rise, and I think in the future this will be the one of the most important things that will be done. And lastly, I would like to talk about, although not new but very important, that is this Ayushman. That is, in the Ayushman scheme, we are at the Yashoda hospitals. We have started this renal transplant, and so the this because under Ayushman, so this will help a lot of poor patients. So under Ayushman scheme, we have started this renal transplant, and 2 days back only we did a transplant under Ayushman scheme. So this will be very much helpful for patients, especially who are poor. This, although not new, but this is also a important aspect, and I think this will be really very beneficial to all the poor people.
Yeah, so I think you have talked about really interesting stuff that hold the promise for the future in cases of nephrology or renal transplant. It is not wrong to say that you talked about your professional front so much and your personal life in a lesser way. So, and apart from that, the doctors are the ones who are always in front when it's need to take care of the patient. So you have proved that just now. So what is the message apart from the professional front? What is the message that you would like to give to your fellow doctors?
Well, this is a very important question. So on the occasion this Doctors' Day, what I would like to say to all my professionals, that we should all enjoy our life, and the minimum amount of time that we get after our hectic busy schedule, we should all be enjoying our life, so that the stress that everyone is having these days, it decreases. And obviously, I think this will be one of the most important things that can help to reduce the cardiovascular risk. So everyone should be enjoying their life, take less stress, and in the free time that they're having, they should be concentrating more on their personal life. and they should all be have enjoying their life. And after all, at the end of the day, if you take little stress, you will obviously be happy and have a very happy life.
Right, and I think as a doctor, you take care of lot of patients, and one more thing that you have to take care is of yourself as well. So this Doctors' Day, I wish you all the very best. That you think about yourself as well, because doctors are also human beings. We have seen a lot of fight during COVID that the doctors did for their patients. So with this, I would like to end this interview here. I would like to thank you very much, and all the
Thank you.
doctors who selflessly serve our nation's health. So I request all my viewers to together salute their dedication, your dedication, compassion, and unwavering commitment towards our health, your patient's health. So thank you so much, Dr. Prajit.
Thank you.
Thank you.
Thank you, ma'am. Thank you.